she present? Okay. Next, I would like to request Dr. Manisha Kumari. Dr. Ankita Singh is present here. Okay, you will be the next speaker. Please be ready.
If you have any inputs, please share them.
Which number? Yes, next left right. Okay, ये आगे इससे जाएगा पीछे इससे जाएगा, ठीक है ना?
Good morning, everyone. I am presenting on etiologic components and prognostic determinants of acquired sixth cranial nerve palsy. Introduction. Cranial nerve 6 palsy has been reported to be the most common oculomotor nerve palsy. It has vascular or ischemic and idiopathic etiologies. However, acute cranial nerve palsy may be an early sign of serious intracranial lesion, warranting careful assessment, including neuroimaging. The recovery rate of cranial nerve 6 palsy is about 60 to 80%, and overall, its recovery rate is good compared to other oculomotor nerve palsies. In clinical practice, 6 nerve palsy is more frequently diagnosed in younger patients than before. Therefore, careful medical history taking and clinical evaluation are as important as imaging in 6 nerve palsy. Aim to determine etiology of 6 nerve cranial nerve palsy and its effects on prognosis. Material and methods: hospital-based prospective study, 52 patients who presented with acquired abducens nerve palsy at a tertiary care center between April 2022 and March 2023 were recruited in the study. History of present illness, trauma, systemic disease were noted. Relevant blood investigations and MRI was done. They were followed up for 3 months. Etiology and rate of recovery was noted. Total number of patients were 52, 28 males, 24 females. 41, that is 79% recovered, and 11, that is 21% did not recover in 3 months. Rate of recovery was 79%. Mean duration of recovery was 70 days, that is 10 weeks. Etiology was, commonest was vascular in 46%, idiopathic in 21%, followed by trauma in 17%, neoplasm in 12%, and other causes constituted 4%. Among the non-recovering cases, mostly were because of neoplasm in 46%, then trauma 27%, 18% because of vascular cause, 9% idiopathic. This is the pie chart showing etiology of 6 cranial nerve palsy, and the bar diagram which is showing the etiology among non-recovering cases, among which neoplasm was the commonest. Elder et al. Have reported that microvascular disease is the most frequent cause of acquired 6 nerve palsy in patients over 50 years of age. Park et al., Jung et al., and Peter et al. Have reported that 28 to 56% of patients with 6 nerve palsy have a vascular cause, and 24 to 27% of them have an unknown origin. In our study, vascular cause contributed to 46% cases of 6 nerve palsy, similar to previous studies. Sanders et al. Reported that 51 of 59 patients, that is 86%, experienced resolution of 6 nerve palsy, and only 3 patients required strabismus surgery. In this study, rate of recovery was 79%. Jung et al. Reported that recovery period was 7 weeks in isolated ischemic 6 nerve palsy. In this study, period of recovery was found to be 10 weeks. So conclusion, most common cause of 6th cranial nerve palsy was vascular, followed by idiopathic, trauma, neoplasm, and other causes. Prognosis was best for idiopathic and worst for neoplastic cause. These are all references. Thank you.
What was the age range of the patients?
Mean age was 47 years.
And how long did you follow these patients up?
Ma'am, for 3 months.
Okay, so you said average duration of recovery was 10 weeks.
Yes, ma'am.
What was the range? There must be a range also, no?
Oh, yes, ma'am. It was 7 to 10 weeks.
Thank you for finishing well ahead on time. I have one question. How do you differentiate, means how do you segregate between the vascular causes and the idiopathic? Like most commonly we see the diabetic patients developing like 6 nerve palsy. So do they fall under, in your case, do they fall under the vascular or idiopathic? Because most of the time we don't get anything in imaging or anything like that.
In our case, we have included them in vascular causes.
Okay. So then how will you classify as idiopathic? You don't get anything.
If there is no systemic association and no neurological findings and no significant history, then
Okay, so if the patient doesn't have diabetes, hypertension or dyslipidemia, then any other vascular causes, then it is idiopathic, right?
yes.
Okay.